My mother, who is 70, she's too old to even have back surgery according to this plan. She's considered a senior who doesn't really need an elective surgery. Very scary. My mother is a viable citizen. My mother is a viable citizen of these United States. She deserves whatever health care she can get to make her life better and viable so she can keep functioning well in society.
You know that you'll be able to hold on to the plan you have that you like.
That's not true at all. There's no way anybody with any common sense will know that maybe for a year or two after the plan is initiated, that maybe for a year or two there will be private healthcare plans, but those will surely diminish after there is a universal healthcare plan. Why should my company that's 20, 25 people, there's no way that he could afford to continue providing private healthcare when there's this universal healthcare that the government provides.
This country does not need national health care. I deal with people in business all around the world. I have lost 2 people to National Health Service incompetence in the UK. They were killed because of the substandard and delayed treatment. I have another one who's been blinded for life by the National Health Service in the UK.
Okay.
Give you an example.
I don't want to have anybody ration my health care. No, it's not a myth. It's right there. Recently, Obama was asked by a 56-year-old woman if she'd have ration health care. After much hemming and hawing, she was told not if there was no answer to it, other than did she get a living will yet?
And who said this?
That was President Obama in his own words. You can go look it up.
You ever kill anybody for America? You haven't, have you? That's because you're a sissy. What about you? You're a sissy. Oh, there's a sissy for you. See you later, Grandma, Big Wolf. You'll huff and you'll puff.
Come on.
So long, sissy.
Come on.
Come on back, sissy.
Tort reform. No more lawyers, no more medical malpractice suits that are ridiculous. That's
you know
what
how
will fix
insurance
it.
works?
And no insurance for illegal aliens.
All right. Why is it that we pay more per capita per person here in the United States than other nations that cover the entire population?
I've got an answer.
Why is that?
We have better health care than all the other nations.
Well, okay, if that were true, then we would also have a higher, we'd have a lower mortality rate, right? We would live longer, right? And the amazing thing is we don't.
No.
We don't have, they have better mortality rates.
That argument's got holes in it.
They have better mortality rates. I think your argument's the one that has holes in it.
And here's one that has holes.
They cover their entire population. They have wonderful health care there.
No, they don't.
Have you lived there? I've lived there, and I've had children there.
That's so good.
Because I enjoy my country as well, and I think we can raise the standards, and we can get there. And this is a good country, and I'm proud of it. We just need to extend it to all Americans.
I don't want to pay for somebody else's health care.
That's right. You want to be selfish. That's your authority.
Can't get it.
Too much money.
I've been in healthcare all my life. And for those who don't want healthcare for everybody, every day we bump up against people with various diseases, illnesses, and so forth, some of which are contagious. And if they are not given access to good healthcare and prevention, all of our health is at risk.
Right.
And for that reason alone, we should have some way of covering people so that they have access to prevention and good health care when they need it. Everybody needs some access to health care to make sure that all of our health is not put at risk.
I'm here because at long last we have the opportunity to have what every other civilized nation on earth has. And that's the opportunity to take care of all of our citizens and not throw people into the gutter, or at least kick them to the curb because they become injured or have other health concerns or sick. And there's no way that things can be done. And I'm one of those folks. I have what's deemed a pre-existing medical condition.
I have great health care, but I'm out here for a friend of mine. And she's a single mother. She works freelance, so she doesn't get her health care from a business or anything like that. So she has to handle it herself. And she's got a young son who I believe is at this point 3 years old. And she pays $1,600 a month in health care. her health care doesn't cover her autistic child. She's got hundreds of thousands of dollars of bills sitting on her desk that are unpaid, and she can't pay them. I mean, she's a masseuse and she does hair. This is a moment right now where we can really make a change and really make a step forward in a positive direction, and I don't think we can pass this moment up.
But there's some provisions that we know in both the Senate and House bills are likely to make the final version. And they are bills that would prohibit the rejection of coverage based on pre-existing conditions. They would eliminate charges for preventive care, eliminate lifetime caps on coverage. Both versions would also establish an exchange for consumers where they'd be able to compare plans side by side and purchase affordable coverage. One of these options would be a government-run public option. Like this and half of you won't, but I believe that a public health insurance option would provide greater choice to families. Well, it's important also to provide competition with private insurers. And act as an incentive for them to lower administrative spending and use more healthcare dollars to provide actual healthcare.
We have an incredibly consolidated health insurance industry. Nationally, in California, for instance, 5 large insurance carriers control 95% of the market. We've all heard about OPEC controlling our oil supply and the large gas prices. Well, you think OPEC's in control, or you should look at the insurance industry's control over health insurance. And that is why we need the public option. Because nothing frightens the health insurance industry more than the ability for people to opt out. Should you not want it, you can stay in your plan. But the public option will benefit you regardless of whether you ever opt into public insurance. Because if the insurance companies know that all of us have the option to get out of private insurance because we don't like the way we've been treated, that's the only thing that the insurance company understands is threats to their bottom line. And if they know we can vote with our pocketbook and buy it elsewhere, they're going to be more responsive to you. There's nothing to fear from the public option.
Right now we have a choice. Are we going to put our faith in an insurance company that bases its decisions on profits? Or are we going to put our faith in a government that bases its decisions on healthcare?
We have the most privatized healthcare system in the world. We've had it for 50, 60, 70 years. It's not like we haven't let the free market had a chance. They've had a chance for 70 years.